Hello, I'm Dr. Muhammad Alvi, Director of the WVU Stroke Center at WVU Rockefeller Neuroscience Institute. In this video, we'll discuss the diagnosis and type of strokes. A stroke occurs when a blood vessel in the brain becomes blocked or bursts, cutting off blood and oxygen supply. Without oxygen, brain cells begin to die within minutes, which is why a stroke is considered a medical emergency. Prompt recognition and treatment are critical to reducing the damage and improving recovery outcomes. Ischemic stroke. Ischemic strokes are the most common type, accounting for about 87% of all strokes. These strokes occur when a blood vessel supplying the brain becomes narrowed or blocked, significantly reducing the flow. There are two main types. The first, thrombotic stroke, which occurs when a blood clot forms in the artery that supplies the brain and is usually due to buildup of fatty deposits like plaque. Second, embolic strokes happen when a clot forms elsewhere in the body, often in the heart, and travels through the bloodstream to the brain. The treatment options for ischemic strokes include clot-busting medications such as tenecteplase, which can dissolve fresh clots if administered within few hours of symptom onset. Endovascular therapies used when medication is ineffective or not suitable. A catheter is inserted through blood vessels in the groin and threaded to the brain to physically remove the clot. Carotid artery repair through surgical procedures like carotid endarterectomy or carotid stenting may help prevent future strokes by correcting blockages in the arteries of the neck. Hemorrhagic stroke. Hemorrhagic strokes occur when a blood vessel in the brain ruptures, causing bleeding to the brain tissue. This type of stroke accounts for about 13% of all strokes. The excess blood increases pressure in the brain and damaging the nearby brain cells. Treatment for hemorrhagic strokes may include medications to reduce blood pressure and limit further bleeding, external ventricular drain to relieve pressure from excess fluid buildup, aneurysm clipping or coiling procedures to stop the source of bleeding and prevent future ruptures. Transient ischemic attack, or TIA, is often referred to as a mini stroke and occurs when blood flow to part of the brain is briefly interrupted. Symptoms are like those of full stroke, but typically last only few minutes. However, TIAs should never be ignored. Approximately 15% of major strokes are preceded by a TIA. Treatment for TIAs may include blood thinners and medications to control blood pressure, cholesterol, or blood sugar levels. Stroke prevention and lifestyle changes can reduce your stroke risk. Quit smoking and avoid secondhand smoke. Smoking is a leading preventable cause of stroke. The West Virginia Quit Line offers free nicotine replacement therapy, cessation coaching, and educational resources. Call 1-800-QUIT-NOW. Eat a balanced diet, low in saturated fat and added sugars. Exercise regularly and maintain a healthy weight. Take medications as prescribed, monitor blood pressure, and manage stress. Lastly, see your doctor regularly.